Straight away go question answer format. University question. Describe axilla as under. Boundaries 5 marks. Contained approximately 6 marks and applied 4 marks. So we will go straight away with the presentation. Purpose is not only to teach, yes, teaching will continue simultaneously, but more aspect is presentation. How you are going to present axilla. Yes, I'll start with the introduction. Don't write in the introduction axilla is armpit, because many examiners don't accept this word as an armpit. Yes, axilla means not only the armpit. So how to write the introduction, because though introduction is not asked, if you write the introduction it will create totally different impression. So you have to write the introduction. It is anatomical space. I'll underline it. It is anatomical space present between shoulder girdle, not joint, shoulder girdle, upper part of arm and upper part of rib cage. That's enough introduction. Now straight away what is asked as under. What is the purpose of introduction? It creates impression on examiner. Yes, there are no marks for introduction, but there is impression. Yes, candidate enters the subject properly. Now coming to the boundaries. Boundaries are anterior boundaries, posterior boundaries, apex, base. Now most important, how to present. Yes, how to present, that is serial number, description of the boundaries and detail. For serial number 1, anterior boundaries, pectoralis major, pectoralis minor. Now I will teach you the boundaries. Yes, that is most important. Now anterior boundaries, yes, they are anterior. So pectoralis major, yes. So you can see its insertion of pectoralis major in the anterior aspect of humerus. So anterior boundary, pectoralis major and pectoralis minor. So you can see clearly here is the pectoralis major. Yes, simultaneously this is practical aspect also I am covering. So anterior boundaries, pectoralis major. Yes, it is attached to intertubercular groove, that is called as latissimus dorsi between pectoralis major and teres major. So anterior boundaries, pectoralis major, pectoralis minor. Posterior boundaries, yes, subscapularis. Again, this is common attachment asked in the practical. So simultaneously I am teaching, but my more focus is on presentation. And you go on adding apex, base is formed by skin and all this thing. So boundaries, you have to make the table, serial number, description of boundaries and details of boundaries. Now let me tell you, immediately once you write the boundaries, you have to draw the diagram which is there in BD Chaurasia or any anatomy book for boundaries. Don't draw the diagram randomly. What students do, they go on writing boundaries, content, applied, and at the end they draw the diagram. That is irrelevant. You have written boundaries and just right below that, remember this sentence, boundaries shown in the table are as shown in the diagram. Means table of boundaries, and immediately down you are showing the boundaries. You are not drawing single diagram randomly. क्योंकि बहुत सारे बच्चे क्या करते हैं, एक तो पहले डायग्राम ड्रॉ कर देते हैं, फिर पूरा क्वेश्चन लिखते हैं, नहीं तो पूरा क्वेश्चन पहले लिखते हैं और डायग्राम्स ड्रॉ करते हैं. ये गलत है. उसके बाद हम बात कर रहे हैं कंटेंट्स की. यस, कंटेंट की हम जब बात करें तो कंटेंट के बाद में सीरियल नंबर, description of content and details. So serial number, axillary artery, axillary vein, axillary lymph node and so on. So content, serial number, description of contents and details of contents. Now serial number 1, axillary artery, then axillary vein, infraclavicular part of brachial plexus, axillary lymph nodes and fat. These are 5 content and you have to describe that. So what are the branches of axillary artery? They are present in brachial plexus. How students write? SP salt. S means superior thoracic artery, superior thoracic artery. P for posterior circumflex humeral artery. Don't write like that, because mnemonics you may forget, and don't claim the number. There are 6 branches. Don't commit number. Just write superior thoracic, lateral thoracic, anterior, posterior, circumflex, humeral. It's sufficient. Though you write 4 branches, it's sufficient, but don't commit number. Don't commit number. That there are 6 branches, because sometimes during stress of exam, yes, you are human beings, we are not computers, rather I am human being. Under the stress of exam, you might forget one branch, so don't commit the number, just write these are the branches. Axillary vein, tributaries, important tributary, subscapular vein, that's enough. Infraclavicular part of brachial plexus, mainly posterior cord and medial cord, and then axillary lymph node. सो ये कंटेंट हो गया। ये पूरा टेबल एक पेज होता है, पूरा टेबल बाउंड्रीज का एक पेज होता है, डायग्राम्स का एक पेज होता है, तो 3 पेजेस का आंसर विद इंट्रोडक्शन हो गया। अभी पूरा लास्ट पेज होता है, वो अप्लाइड एनाटॉमी के लिए होता है। अप्लाइड एनाटॉमी में ब्रीफ में बात करूंगा। अप्लाइड एनाटॉमी ऑफ एक्सिलरी आर्टरी, yes, it is used for cannulation during cardiac procedures. So axillary artery used for cannulation. This is one point, clearly you have to explain, you will get 1 mark. Now second is most important, there are 2 marks reserved for this, axillary lymph nodes. Yes, axillary lymph nodes are classified as anterior axillary, posterior axillary, central, apical. And why these nodes are important? Because these nodes are increased in breast cancer. So usually patient of breast cancer which advanced stage, I'm not saying metastatic stage, but advanced stage का जो breast cancer होता है, axillary lymph nodes oncosurgeon देखता है। yes, oncosurgeon axilla में देखता है। 2 breast cancer का केस है, और अगर उसको एक्सिलरी नोड फील होता है, सो दैट इज डेंजरस। सो एक्सिलरी लिम्फ नोड्स आर मोस्ट इंपॉर्टेंट नॉट ओनली इन द डायग्नोसिस ऑफ breast cancer, but for grading, that is staging, grading, staging and prognosis of breast cancer. So axillary node पे हमने बात किया। So ये एक चीज है। And one point you can add, yes, there is possibility of inflammatory skin disease due to perspiration in axilla. So skin disease, so 3 पॉइंट हमने लिखे, पर सबसे अहम पॉइंट जो 2 मार्क वाला है वो एक्सिलरी लिम्फ नोड्स। ये एक्सिला का आंसर होता है, करीबन 4 पेज का आंसर होता है, विद डायग्राम्स होता है। अप्लाइड में हम डायग्राम्स यूजुअली ड्रॉ नहीं करते, लेकिन अप्लाइड में एक छोटा डायग्राम है जो बीडी चौरसिया में है, एक्सिलरी लिम्फ नोड का लोकेशन, वो एक आप डायग्राम ड्रॉ कर सकते हैं। तो आपको समझ में आया कि लेटेस्ट एग्जाम सिस्टम में एक्सिला में क्या देखा जाता है, हाउ इट इज प्रेजेंटेड। यस, साइमल्टेनियसली व्हाइल प्रेजेंटिंग आई टॉट यू द एक्सिला। ऑल द बेस्ट।